in the next couple of minutes, we're going to be talking about what we're doing differently to ensure that we not only decentralize COVID-19 vaccination, but we make sure that we improve coverage and access to COVID-19 vaccination. Today, we're vaccinating at over 200,000, just a little over 200,000 people per day. But for us to be able to reach our target of reaching 70% of eligible populations before the end of 2022, we have to hit 550,000 people per day. That means more than doubling the number of people that we're vaccinating. This COVID-19 number has been understood by people at the national level, the state and the local government level. So every state understands what it means to have a COVID-19 number. Those are the numbers that tells you exactly where you are in terms of your progress towards reaching those numbers that will ensure that you reach herd immunity. Today, we're also going to be launching the single-shot vaccine for everyone, the Johnson & Johnson vaccine. We understand very clearly that one of the reasons why there's a gap between our first and second doses is because people experience COVID-19 adverse events following COVID-19 vaccination. Although these adverse events are largely mild, we know that the opportunity to have that single shot, not only in the hardest to reach areas, but everybody having access to one single shot will definitely increase our coverage for COVID-19 vaccination. We'll also be launching the COVID-19 vaccination site finder. This will again improve the ability of Nigerians to access COVID-19. So wherever you are in Nigeria, if you're able to sign in onto this website, you'll be able to, you'll be shown the nearest COVID-19 vaccination center. So you can make your way to this very center. For those of you who've had the opportunity of listening to some of this engagement, we want to underscore the fact that there's no better time than now for us to ramp up COVID-19 vaccination, given that we now have access to vaccines that have long shelf lives. In the last couple of months, we struggled with vaccines that had short shelf life, so that planning was a challenge. But this pause, this relaunch of the Scales 2.0 is an opportunity for us to bring everybody together and plan even better to make sure that every Nigerian has access to this vaccine.
The US government has worked very closely with NPHCDA and partners on the first Scales strategy. We recognize that Nigeria has done some good work vaccinating on average about 200,000 persons each day. But we know we have much work to be done to get us to 600,000 people each day. And that is no small task. And we're excited of this new Scales strategy as we feel it will move the country to that 600,000 number that you're hoping to achieve. The US government, including the US CDC, USAID, the DOD, and of course the ambassador, the US State Department, stands to continue to support NPHCDA, and at the state and local government levels where we have partners to help work with you to implement this big thing. We also recognize that we can use this COVID-19 response and approach to build other programs. We can use this approach to integrate with all the other services, which we know that the Scale Strategy 2.0 is building upon. We look forward to using the resources that we have at the state level and at the national level to support the government in achieving this big task ahead of us. We know we're running against time, and we are all geared up to work with you to move the needle forward and to bring Nigeria to the top of African countries that have achieved 50% coverage in the next couple of months. If Nigeria can do it, we know Africa has done it. And so therefore we are standing here, supporting you, working with you through the thick and thin, but more importantly, coordinating with all our various partners.